Hi, my name is Danielle Dixon and I am an LPN for the Lawrence Association. Today we're going to be talking about a medication verification software and the need for it at the Lawrence Association. On the agenda today we're going to be talking about why we need this software, what does the whole project entail, what is the budget we're looking at, and then we're going to wrap everything up and then talk about any questions anybody has. So why do we need this software? Well, the main goal of the software is to help minimize medication errors at this facility. There are an average of 1.3 million medication errors that happen in the United States, so the goal of the software is to minimize it at this specific facility to help all the numbers go down. Mistakes can be made by any personnel. Many people think that medication errors are just caused by the person administering the medication, and yes, that is a big number of people, but it can also be caused by the person prescribing the medication, the person that's transcribing the medication, the person administering the medication, or the person observing the patient after the medication has been administered. Okay. So this is a chart that shows some of the medication administration errors. As you can see, administration is the biggest piece when errors are made, but then dispensing and transcribing are two pretty big areas as well. Okay, this system is also going to help make communication through the facility easier. This program is going to let anybody in the facility communicate with anybody else freely whenever they need them. So this could be like when the doctors need to talk to the pharmacist and the nurses need to talk to the doctors. Everybody's going to be able to talk easily through these messaging and note boards. Okay, so knowledge-based errors are also something that causes a lot of issues with medications. So knowledge-based errors are basically when the person administering the medication doesn't exactly know what the medication is. So this means that it could cause the patient an allergic reaction, or the two medications that they're taking could go against each other and contraindicate each other, and there could be issues from that. So this new computer system, you'll get a red flag if the patient, if you're trying to give a patient something that they're allergic to, or if two medications should not be taken together. It also has an online pharmacy. So if any nurses or anybody who is administering medications, they can go onto this online pharmacy and look up any contraindicators of it, any allergies, or just what it does in general. And again, it also lets you talk to the doctors or pharmacists if you have any questions. Okay, so the project description. So pretty much we're going to install some new software, train all the staff members of how to use these new computers and this new software, and then each month the project director is going to document how it's working for the patients, how it's working for the staff, and in general just the statistics of how many errors we are reducing in the number by. Okay, so this is the new Ergotron computer system that we're looking at using. As you can see, it's on wheels. It can go to any room, it can go to any part of the facility, it can go to the nurse's station, it can go anywhere you need it. So you always have all of the patient's information at your fingertips, which is really great. It also has this little lockbox down here that you can put different patients' medications in, so you don't lose it, you make sure nobody's tampered with it, it's locked, it's not going anywhere. And also on the back here you see that there's a scanner. So this scanner is a medication and bracelet scanner. So when the nurse goes into the room, they're going to scan the bracelet of the patient, make sure that they have the right patient, and then they're going to scan the medication. When you scan the medication, it's going to show you if you have the right patient, if you have the right medication, the right dose, and the right route of administration. So this is going to take the amount of errors and reduce it dramatically. So when the medication is scanned, it will alert a nurse if there's any interactions or any allergies that they should be aware of. And maybe the nurse is already aware of it, but it's just an extra precaution. Okay, now we're looking at the budget. So these Ergotron computers, we're looking at getting 5 of them to begin with. This is going to cost about $3,000. The computer system itself that is going to go into each of the Ergotron computers is $50,000. The project manager to help make sure that the software is running smoothly and that all the staff is well aware of what's going on. That's going to cost about $25,000. The staff training is going to cost about $5,000. And then getting the whole system put into place is going to cost about $7,500. So this is a total of about $90,500. If you look at the facility average last year in the United States, most facilities were spending about $13,000 because of medication errors. So within 7 years, when the medication errors drop, this project will have been paid for itself, and then the facility will start making even more money than they already are. So it's going to be helping the facility, the patients, and the staff. Okay, so in all, we are looking to minimize medication errors because that is the number one priority. Patient safety is the number one priority. We also want to educate the medical staff because if someone's administering something and they don't know what they're administering, we want to be able to teach them so that they can learn, so that they can do better for themselves and keep the patients safer. And then we're also going to maximize profits for the facility, which is also very important. Okay, so if anybody has any questions, please feel free to reach out to me with any that you have. Thank you for taking this time to look over this presentation.